And welcome back. Dr. Mark Simpson with Simpson Dental Associates joins us now. If you have a question for Dr. Simpson, the number is 7. Thanks for stopping by. How are you today?
It's always a pleasure.
Yeah, you always bring the coolest contraptions.
Well, this is a very important one because it helps us diagnose oral cancer.
Right.
Unfortunately, oral cancer, the survival rates have not improved much. Last year, there was 43,250 Americans diagnosed with oral cancer. And the way you use this machine is you basically turn on and look through it, and the cells will appear dark if they're abnormal cells. And so we check the patients every time they come in for their regular checkup in order to determine that. See, the problem is oral cancer is a hard thing to diagnose a lot of times, a hard thing to find. And a lot of people will pass it off and say, well, I burnt my tongue, or I did this, or oh, they usually have a reason why they have a lesion. And we'll say, well, it looks dark, we need to take a look at burn your tongue and it can go away and heal. But half the people that are diagnosed with oral cancer will not be alive in 5 years. So that has not improved in the last 10 years.
That's why it's so important to get it checked. Well,
Absolutely.
Our first caller is on the line. It's Debbie. Hi, Debbie.
Hi, hello.
How you doing? What's your question?
Dr. Simpson, I am absolutely petrified of the drill that the dentist uses.
Okay.
Do you all use like laser or anything? And if it's to the dentist and so traumatic, but
well, things have changed a lot. And number one, we have lasers, and there's another thing called air abrasion that works very well. You know, the key, of course, is to catch things early. And the earlier you catch it, the less it takes to resolve the issue. But yes, there are very many different options for a person that's afraid of the dentist. The other thing is sedation. It's a wonderful thing that helps a lot of people.
I don't like that drill either, I'll be honest. Our next caller is Danny. Hi, Danny. Welcome to Ask the Dentist.
Hey there.
Hi, Danny.
Hey, yes, sir. I got a question. It's kind of like not exactly about teeth, but it is. How do you feel about, I have tried to, like, write legislators and things like that about trying to get more help for people with the cost of taking care of their teeth, like people that are on Medicaid, Medicare, things like that. They got coverage, but they don't have tooth care coverage.
Well, I think that's a great thing, and I appreciate your efforts in trying to help people. You know, the most important thing that can be done is prevention, because most all dental disease is preventable. So if we start children out and teach them how to brush and floss their teeth, and, you know, it's like I have people walk into my office carrying a Coca-Cola, and I'll say, you know, why are you drinking that? That's the worst thing you could do for yourself. And then you look in their mouth and they have decay. So a lot of the things that people cause their own problems with dental disease. So prevention's the key there.
Okay. Robert is our next caller. Hi, Robert.
Good afternoon. I'm pleased to speak to you. I've got a question. I've had oral cancer.
I'm sorry to hear that.
And I've had radiation and chemo treatment. I'm 6 years out, so I'm doing real well.
Congratulations.
Thank you so much. The biggest question I've got is about implants, and after radiation, you know, whether I'm a candidate for that at all.
That has to be determined by your oncologist and where they irradiated you. Oftentimes, you're not a candidate for dental implants after that because the bone has a tendency to die back. The other thing I'd like to point out is that we're having another dental implant seminar coming up May 5th at 6 o'clock. So that's a great opportunity for people who are asking questions about dental implants to get their answers that they need.
And that's May 5th.
Yes, right. Enjoy it.
Simpson.
Thank you for your time.
Now let's